Okay, dear students, today we will be talking on dental caries or dental or tooth decay. Usually, in the local terms, we also use the word that is a teeth worm that is eating our teeth, but actually, it's not a worm. So, today we will understand what is teeth worm or dental caries. So dental caries, in simple words, we can say is a tooth decay, a localized post-eruptive pathological process of external origin involving softening of hard tissue and proceeding to formation of cavity. So actually, it's a pathological process in which the hard tissue of the teeth is decayed, and then when it is decayed, there is a cavity formation or a disease where bacterial process damage hard tooth structure. These tissues progressive breakdown producing dental cavities. Like cavities means here is then after the decay by the bacterial process or some pathological processes that we will see later in our lecture. There is holes in the teeth, right? And that we call is dental cavities. So you see, this is the teeth, this is the hard surface animal and all these things. So you see this black color here is a decay in the teeth. So normally we say the tooth worm is eating our tooth, but it's due to some pathological process where this hard surface of the teeth is decayed and a cavity formation occurs. Epidemiology of this thing is most is 90% adults have experienced this caries in their life, and then a lot of school age children and adults and these all in their life they suffer from the dental caries. Etiology. The main thing is main factor involved in dental caries are the host factor and supragingival plug, and then diet and time necessary. So we will discuss one by one. The host factors first. There are two main factors. The first factor is surface of the animal and dentin material like mineral and fluoride components of the tooth, and then composition and flow of saliva. So how these factors work, like for example here. Okay, so plaque, bacteria, acid, food, debris, and saliva combine in the mouth to form a sticky substance, sorry, build up within 20 minutes after the eating. And then acids in the plaque, then what they cause dissolve the animal surface and then create holes in the teeth. And then after that, they start affecting the tooth nerves. And then when there's a lot of tissue of the tooth is decayed, then tooth fracture will occur. In the beginning, this will be painless process, but with the time, this will become very, very painful. So bacteria involved here is Streptococcus mutans and Lactobacillus actinomyces. So this is the actually process of tooth decay. Certain risk factors, certain foods and drugs and carbohydrate, sugar and starches, they are sticky foods. So they stick on the teeth surface, and then there is a cavity or plaque formation occurs. Frequent snacking and sipping, not brushing your teeth. So, after the brushing, you remove this sticky material and bacterial growth in the mouth and prevent the cavity formation. Bottled water, mostly they lack a lot of minerals and things. So this also weaken the tooth. Weak or rough dental filling. So once you fill your teeth and that filling is weak or bad, and then this filling will fall down, and again the dental caries will start, you know, forming more and more because they are weak. So through this there will be so then this will also cause a more cavity formation and eating disorders like more sugars and carbohydrates we uh, already discussed, and then tobacco. So there are different kind of plaque formation in the teeth, right? So we can know that there is like fissure, like this area of the tooth, this kind of surface we call it fissure, or a proximal plug between the two teeth, and then buccal lingual aspect and gingival crevice plaque. So these are different kind of common area or major areas for the plaque accumulation. So what happened actually in the beginning? There is a demineralization occur. Caries, like for example, acid lower the pH of the tooth surface, causing calcium phosphate and other mineral to diffuse out of the animal, creating a subsurface lesion, right? And then remineralization is deposition in the subsurface region, right? So this how the remineralization occurs. Classification based on the position, bed and fissure, smooth surface caries, and root surface caries. So you can see here different kind of. First one is pit and fissure caries. Site is mostly an occlusive surface of molar and premolar. Mostly you can see here, and buccal pits of the molars and lingual pits of anterior teeth. Dental sealants, like we use some material. First we clean this area and then we seal it with some kind of materials. And then fluoride has leads. Sometimes we use fluoride to coat the teeth, but they have least preventive effect. Smooth surfaces carry on the surface, tooth surface, except fissure. You see pit or fissures. So the dental caries on the smooth surface, right? Proximal or cervical. So these terms you should be going to first review the first lecture on dental anatomy. So here you can see is root surfaces carry. You see there is a root surface, right? So here you can see dental caries. So there are different places where these dental caries occur. Number two, based on progress, remittent caries is sudden appearing, rapidly borrowing type of caries result in early pulp involvement. A different kind of caries, like we give the name. So one is the rampant caries, one is slow caries, or arrested caries ceases to progress further after initiation. This kind of caries is initially formed, but after that it stops growing. But this one is very fast and it damages the tooth a lot. And recurrent caries is that caries reoccur after the restorative treatment done after removal of first initial carious lesion. So recurrent caries is the one that form again after the treatment, after the filling of the teeth. Causes of what is that caries lesion not completely removed, poor adaptation of restoration, like the material that you have used to restore was not good, right? Is not in the position, so it will not like stay there for a long time. And split of margins of restoration and tooth. So for example, the margins are splitted. So again, what happened that there is a pathway for the recurrent caries, something like this. So you see these are the recurrent, even they are filled in some areas, but this one is. So this here you can see active caries with rapid tooth destruction. These are active, and then after 2 weeks, after a few weeks, several months later, improvement of oral hygiene arrested a caries lesion. Like for example, if You see suddenly active caries is like this, but after that, if you if you start caring about the teeth, several months later, they will stop growing. So this is the recurrent decay. You see example. Okay, so now you see picture one is the tooth surface is how this process actually occurs without caries, right? And then a small white spot form initially. Then third step, the enamel surface will be broken. At the fourth step, the secondary caries will occur. And then five demineralization occur with this thing, all this other caries will occur. And six, you see the whole tooth is fractured. So this how this progress. Symptoms are very easy. Everyone, I think, have experienced this symptom. Toothache or tooth pain. There will be tooth sensitivity. Like if you eat something, you will feel cold sensation, hot sensation, severely, and then mild to sharp pain when eating or drinking something sweet, hot or cold, and then pain that lasts even after you stop eating or drinking. Visible holes or pits in the teeth, pain when you bite down, pass around the tooth. So these all are the symptoms of dental caries. Exams and tests, we look there, okay, and then probe and thermatic test, and then after that we use X-ray and cross elimination, right? So light will be not transmitted. Light transmitted from one side of the tooth to the other, but when this caries formation, the light will not transmit it. So here you see the examination of the tooth, how you will examine, and what actually we do is we use this kind of instrument that is called our sand blaster that literally sprays away decay with heat without heat. Vibration, actually this thing vibration, having the vibration, that wing kick the instrument that vibrates in a very high speed, and when you touch it to the plaque, it breaks the plaque into um, small pieces. So what are the treatment? Treatment may involve the filling, crowns, and root canals. So first step, we remove the decayed tooth material with a drill. Then we replaced it with a material. And crowns are something that we use on top of the teeth to cover the teeth. So crowns are often made of gold, porcelain, or porcelain attached to metal. Or root canal is recommended if the nerve in the tooth dies from decay or injury, because sometimes this cause a lot of pain. So you see there's the dental caries, and then later we have used some material to cover it. So you see this whole process. This is the process of we use some needle to root canal. So we put in the root, and then we first we cover this, um, push these nerves, and we cut the nerves. After that, we put some materials on the tooth and then cover the tooth. Before and after, you see prevention. So brush the teeth or rinse in the mouth with water, flossing at least daily, minimum snacking, avoid constant sipping of sugar drink, avoid frequent sucking on candies, regular professional cleaning, go to the hospital and clean your teeth at least every 6 months. X-ray, use dental sealants, and then sometimes topical fluorides are also helpful. So this is sealant. Are the what are the sealants now? A thin plastic-like coating applied to the chewing surface of the molars. Before sealant and after sealant. And these are some, fluorides can, paint with the fluoride that help in prevention of plaque formation. Okay, so this is the way to brush the tooth properly in the 5 steps, and this is dental floss you have to use to clean the debris that is stuck in between the two. Also, you can use some kind of mouthwash and available things available, and there is a some kind of small brushes available so that you can brush in between the tooth. Okay, so thank you very much for today's lecture. I hope you have learned something.